This has been a particularly tough winter thus far. Very little sunshine, lots of bad weather, all making for a very difficult experience. Tough to get outside, you can't get any fresh air, and people are starting to feel really sad and really depressed. Now, it's not unusual at this time of year, but it seems to be worse and more people are being affected. Joining us this morning is the author of Life Unlocked and Harvard Assistant Clinical Professor of Psychiatry and Brain Imaging Research. This is Dr. Srini Pillay, and we're so glad to have you back. Now, this is called, I want to get the name of it correct, it's called Seasonal Affective Disorder.
That's correct.
Okay, what is it exactly?
So seasonal affective disorder is a type of depression. And it can be either depression or it can be a manic depression. But what's different about it is that it occurs specifically during a particular season. Now, most commonly it occurs in the winter, but believe it or not, some people have it in the summer.
Right.
So usually when fall comes around, people start to get more and more depressed. And what's different about this is that if for 2 years in a row you notice that you're getting depressive symptoms and that this is specifically tied into the winter, you may have seasonal affective disorder.
Now, some people may just be feeling a little more depressed, a little more anxious this season because you can't get outdoors, because there keeps being, you know, it's scary on the roads, you're shoveling, there's more work, you're concerned about your kids. That would not be unusual, correct?
Absolutely. No, I think most people feel a little bit down, especially, I think, come February 1st with this much snow and having a really hard time getting around.
Right.
So I don't think you necessarily have the disorder. I think when you know you have the disorder is if you have persistent symptoms of depression for at least 2 weeks, together with a couple of other telltale signs. Now, seasonal affective disorder actually has a lot of the usual symptoms of depression, except that some of them are reversed. So whereas in depression sometimes you have difficulty sleeping, in seasonal affective disorder, a lot of people sleep for much longer than they necessarily want to. There's also a lot of carbohydrate craving, and a lot of people feel this kind of leaden paralysis. They can't really get around. And those are some of the signs, the telltale signs, that maybe this just general annoyance and this general anxiety and this general depression is actually going over to the other side.
Okay. Now, if you think that you suffer from that, what should you do? S.A.D, as it's called.
Right.
What should you do?
Well, I think professional help is really in need. And that's because if you think about some of the treatments that are available, one of the most effective treatments is light therapy. And if you use light therapy that's prescribed in a very particular way, 10,000 lux, which is the strength of light that's needed, given especially in the morning, this can actually help alleviate symptoms. In addition, there are some medications that can be helpful, not just for the treatment, but for the prevention of it. So your doctor can actually start you on something like Wellbutrin, which they can start in the fall and then take you off of that in the spring. So those kinds of treatments, as well as cognitive behavior therapy, can be helpful for seasonal affective disorder. But as you said, this is particularly for someone who's been diagnosed with the problem.
Right. So let's talk about what those of us who are just feeling sort of down in the dumps and blue because we can't get outside and we don't know what the rest of this week is going to bring. What can we do?
Well, I think there are a lot of different things. I think the first thing, which may seem counterintuitive and kind of a drag, is exercise. You know, studies do show that exercise actually helps alleviate depression. So if you exercise more, and you know, this is a time when you can be at home or you can be in a gym, you can exercise, I think it can be particularly helpful.
Sure.
Also, because of this carbohydrate craving, a lot of people end up putting on weight during these months. So if you're a little bit more aware about healthy eating habits and focus on keeping yourself in a healthy frame of mind, surrounded by healthy snacks, I think that's important. I think it's also important to be able to treat yourself, you know, being able to get that massage, get that facial. You know, if you want to just relax a couple times, I think that that's important.
Sure.
If you have the means and are able to go away to a sunnier climate, that may also be helpful. You know, if you actually look at the rates of seasonal affective disorder, they get higher as you go from Florida to Maryland to New York to New Hampshire.
I'll bet.
So if you go...
Warm weather will do a lot for you.
Warm weather does help.
Right. And I would think, too, just setting some goals for what's yet to come. You have to have something to look forward to at this point. It sort of feels like the world is, you know, coming down on you. So if you have something to look forward to, be it in March, be it in April, maybe that gets you through the next couple of months.
Absolutely. I think the proverbial light at the end of the tunnel is the thing to look forward to.
I think you're absolutely right. We will all get through this, folks. There will be a spring. You just have to try to make it between now and then. If you need more information, it's SriniPillay.com. Nice to see you, Doctor. Thank you
too.
For coming
Thank you very much.